Do we live in a day and age where there is more or less of a weight problem? More or less diabetes diagnosed in this country every year? The children are getting bigger and bigger. The adults, we're getting rounder and fuller. Our stomachs are getting stretched out from these super-sized meals. And with that, with all the sugar that we're taking in, or even complex carbohydrates, it is throwing off our metabolism. It's starting to affect our insulin levels, our pancreas, the beta cells of the pancreas. It's starting to, stress is affecting the adrenal glands and cortisol. I mean, are we living in a world that has more or less stress each day as we think about what's going on in the world and how we're going to pay our bills at the end of the month, and if Mr. Jones down the street likes us or not? Do we cut our grass enough and take our kids to the nicest schools? Are we good enough as people? So we're constantly stressed, and that affects the adrenal glands. The adrenal glands are firing. And cortisol is very damaging. Okay? It's just terror on the body. Okay? And plus, when the adrenal glands become depleted, then we start having problems with the production of cortisol when it's needed to get sugar from the liver. So last year, I finally balanced my blood sugar. I was on a roller coaster ride all throughout high school and college, and even beyond that. I was on those, I'm hungry, and now I'm sleepy after I eat. I'm hungry, and now I'm sleepy. A big meal wipes me out. I go get to the buffet, and I eat the healthy stuff. I get the breads, and I get the healthy whole wheat, and it knocks me out. And I'm just gone. Narcolepsy, food-induced coma. And if your patients don't know what to eat, how to eat it, when to eat it, and what not to eat specifically, then they're going to go through those cycles, potentially. They can become, and that's especially stress-related, they can become hyperglycemic or reactive hyperglycemic, or on the other end of the spectrum, they can be hypoglycemic, where they're constantly eating those meals because they're hungry, versus the hyperglycemic, which is reactive hyperglycemic, which is syndrome X, metabolic syndrome, pre-diabetes, becoming insulin resistant. All of these things apply. And you're going to find these patients, and when you start working with them, when you start treating them neurologically and metabolically, when you take a look at the whole picture, okay, the endocrine system, the chemicals that are produced, and how the brain is firing to the body, when you look at them as a complete system of chemicals and electrical firing, and there's tests that you can run, balance tests, electrical tests, strength tests for the neurology part, and then for the blood chemistry, obviously, for the endocrine system. And then food sensitivities to gluten, casein, soy, egg, yeast. I mean, do we hear more and more food sensitivities? How many people know about, of your patients know about gluten intolerance? Yeah, at least half the audience here. And how many of them know about soy intolerance, or corn, or casein, milk, lactose intolerant? USA Today had an article about how many people are lactose intolerant. And in fact, it is the opposite, that the ones who are tolerant to it are in fact the X-men, the genetic weirdos, because we should stop producing these chemicals after 2 or 3 years of age when we stop drinking breast milk. And I know some people don't breastfeed at all, or some breastfeed for just 6 months or a year, but the body should pretty much stop making that enzyme to break down the lactose early on in life. So if we still carry that on, there's a genetic population that is able to, typically European descent, but more and more people are becoming insensitive or intolerant to certain foods. Yeast, egg, gluten, corn, soy, casein, those are like the biggies right there. And you're going to find those with the sensitivity testing, with blood work, with the ASI, the adrenal stress index. And when you start looking for those as a complete person, as blood chemistry, as body chemistry, as the endocrine system, as pituitary, the hypothalamus, all these different glands, the thyroid, the ovaries and the testes. And when all these chemicals are producing in the right amount, you can have health. Okay? When body chemistry is off, then we call that dis-ease or disease, or we start giving them named conditions. And again, more and more people are getting insulin-resistant diabetes. They're becoming reactive hypoglycemic, hyperglycemic, or hypoglycemic syndrome X. It's all the same roller coaster ride, or just like plunging off of ability to process your own chemicals. The receptor sites that are constantly being bombarded with insulin because we're eating so much carbohydrates, simple and complex, the receptors start to shut down. So instead of it coming in and grabbing onto it, it says, uh-oh, here comes more, I don't want it. It's like a flower closing down. It's like when there's too much rain. Because the flower will open up to the rain and the sun until it gets too much. And it's like it's getting puked on. And it says, oh no, don't get that near me. And the receptor sites start closing down. And that's when you develop insulin resistance. It's actually insulin receptor site resistance. And we'll talk about that